All right, let's go ahead and get started. Today is December 1st, and I'm going to turn this over to Gary.
Thank you, Chair. All commissioners are present. We have a long list for you. Let's get started. First is Wildfires update. Nancy Bush, Director of Disaster Management and Incident Commander of our Emergency Operations Center. Please go ahead, Nancy.
All right, good morning, everyone. So to run down our numbers, and as I go through the numbers, I want to remind everyone that our individual assistance did close yesterday. So I'm going to talk about our numbers that we have so far, but I think next week we'll have those final numbers for the individuals that have required or have requested assistance. So on the state level, there's 25,072 that have registered for individual assistance, 24,200 or 286 are valid registrations. For those breakdowns, we have 6,995 that are owners, 17,262 that are renters. And I just want to say this becomes very complex for renters, and obviously most of our individual assistance is for renters. There are 23 that are not specified at this time. In the state, there are 472 maximum grants, which is $35,500. And those grants are given to those who have total losses of their homes. As far as the vulnerabilities breakdown, statewide, those are over the age of 65 is 3,707. Low income is 3,313. And access and functional needs is 1,817. So far in statewide, there has been $22,106,740 that has been given out in assistance. Here in Clackamas County, we have 2,415 that have registered. 2,384 of them are valid registrations. 1,000 are owners, 1,382 are renters, and we still have only two the maximum grants here in Clackamas County. The total amount here that has been sent to individuals is $340,395. And our breakdown for vulnerabilities is age 65 and older is 416. Low income is 452. And access and functional needs is 236. And also want to remind everyone for the access and functional needs is self-identified. So we still have a lot going on here with debris management. We did get a lot of the answers that we were seeking about the debris management and what it means for us, especially when we talk about public assistance, which is taking down the trees, mostly here in our county. And we do have an IGA that we just received that we're taking a look at now. We'll be running that by legal, and hopefully we can get that in front of the county commissioners very soon. For the PPDR, which is the public debris removal for private homes, that is still moving forward. The state of Oregon is still in the middle of getting the contracts done and working through that. And as they're working through all of that, we are working to make sure that we can get as many right of entry forms for those who would like to have their debris removed. So it's debris and ash. The hazardous waste hopefully has all been removed at this time. And again, just to remind everyone that will be free of charge for those that do sign the right of entry forms and are eligible for that removal. And then that is all I have for wildland fire.
So Nancy, if the debris removal, I assume, is charged against the $35,000 that someone might receive?
Is charged against? No.
No.
The 35,500, they do not, if they sign the right of entry, they still would keep that 35,500 and the state would still remove the debris and ash. Is that what you're asking? I want to make sure I understood that.
That's exactly right. Thank you, Nancy. I appreciate it. Mm-hmm. Any other questions on this issue? All right, Nancy, go ahead.
All right. Gary.
Now the COVID-19 coronavirus update, Nancy, and then we'll bring in Philip Mason Joyner, our public health director.
All right. So we'll go through our numbers here for today. So in the state of Oregon, we have 75,431 positives. 912 deaths, which is up 86 from last week. 1,871,223 negatives. Clackamas County has 6,395 positives, 77 deaths, which is up 1 from last week, and 92,172 negatives. Multnomah County is now at 17,556 positives, 239 deaths, 213,659 negatives. Washington County is at 10,554 positives, 102 deaths, 135,796 negatives. Statewide, hospitalizations are 584, which is up 128 from last week. Our adult ICU beds available here in the state is 169, which is up 60. Vents available is still over 700, which is now 741. In Region 1, which is Clackamas County, Columbia County, Washington, Multnomah County, Tillamook, and Clatsop, there are 329 staffed adult ICU beds. 257 of those are occupied. 72 beds are available. And I will say, I found out yesterday, of course, this number changes by the hour. We had 59 here in the Tri-County region, which is much better than what we were seeing before. Non-ICU beds here in Region 1 is 1,903 that are staffed. There's 1,720 beds occupied and 183 are available. And I just want to show real quickly here one of our graphs that we have. So this is a graph that does show what has been happening over time. This starts in April, and you'll see here in April, we had this peak, a low here, and then of course there's this other peak that came in July that we've talked about when most of the counties in the state were peaking. And this is hospitalizations, and now you're seeing it, of course, climb and climb and climb. So this kind of shows everyone, over time, how we have had, there's the 200 hospitalized patients under 200, and right here, starting in November, it went over that 200 mark. This right here is COVID patients that are in ICU beds, this light blue, and this very, very light blue is those that are on ventilators, which again, you see those continuing to climb. Okay, stop there. So what we're looking at for the week, our cases for November 23rd through the 29th is 917 cases here in Clackamas County. And again, that is another high for us. That's 216.5 per 100,000. As of Monday, yesterday, we have 73 outbreaks that we're working here in Clackamas County. 19 of those are workplace, 10 are food and farm. Long-term care facilities and retirement is 34. Daycare is 2, school is 2, healthcare setting is 2, social is 2, and other is 2, again, for a total of 73. Just to remind everyone as well that we continue to really take a close look at those long-term care facilities and other congregate settings because we know how quickly it can move through those settings, and we also have very vulnerable populations there. I also want to let everyone know, of course, we have our business grant application that is open. As of yesterday, we had 524 small business grant applications and 37 child care applications that were in. So BCS is doing a really good job trying to get the money out as quickly as possible. And thanks to the commissioners as well, agreeing to put a little bit more of the CARES dollars, $150,000 into that first round that we had, making that complete, because we did have several applicants that were eligible but didn't get money because we ran out of money. And we want to thank you for letting us move some more CARES dollars into that so we can make those and get those businesses some of those dollars as well. And that is my COVID update. And I don't know if we want to go right into Philip and then we can ask questions after that, Gary.
Yes, please.
Okay. So Philip Mason Joyner is here with me today, and he is our Public Health Director for Clackamas County and is going to talk about the new measures.
Thanks, Nancy. Good morning, commissioners. I do have slides to share what the state is calling Oregon's Risk and Protection Framework. So these are the new metrics and new thresholds for reopening communities as it relates to our response in Oregon to the COVID-19 pandemic. And Christina, yes, you should have the slides. Perfect. And you can go right to the second slide for us, please. So currently we've been in a 2-week freeze, the state of Oregon has been, to try to slow down the significant surge in COVID-19 cases. Last Wednesday on the 25th, the governor did hold a press conference to share what these new metrics and what the new different framework, what it will look like starting this Thursday. The good news is that the approach that we had previously been using around baseline, phase 1, phase 2, the metrics associated with phase 2 are no longer in use. This does simplify them. We have new metrics that align quite well with the school metrics for reopening to in-person instruction. And local public health officials around the state have been meeting with staff and leadership at the Oregon Health Authority for several weeks prior to this announcement to provide input into the metrics to make it a little bit more easier for the community to understand, and that it really be based on science. And also, activity levels and things that we've learned around businesses and how to have general guidance in place that really does protect the public and support businesses being able to reopen as safely as possible once the metrics support that. The other good news for Clackamas County is that we are no longer tied to Multnomah or Washington County for reopening. We are accountable to the 2 reopening metrics that we'll share on the next slide. So now, instead of the different phases, it's really based on risk level: minimal risk, moderate, less, substantial risk or spread, and extreme spread. And there are 2 indicators that we're looking at. It is the rate of COVID-19 cases per 100,000 over 14 days, and the percent of test positivity over the previous 14 days. So until the fall occurred, until the wildfires, all summer, spring, we were in more of the moderate level, some weeks substantial level. But currently in Clackamas County, we are at that extreme spread level. If you go to the next slide, Christina, I can show you the exact data for Clackamas County over the past 2 weeks. So this was pulled based on what's on the website as recent as the 28th. And our understanding is that they'll be pulling this data at the state level and posting it publicly. They'll be doing, they define a week as every Tuesday to Monday. They pull the data on Monday and release it. I believe that's the plan. I know that state staff are working really, really hard to get everything in place for this new model to begin on Thursday, and is of course subject to change. And then the next slide just shows you, in terms of the extreme risk, what the differences are. The most significant differences being eating and drinking establishments that now outdoor dining is allowed with specific capacity and occupancy numbers and other restrictions in place that are described here. And in retail stores, right now in the freeze, all retail has been at 75%. Once you're in the extreme risk as a county, that is 50% capacity is what is required for retail stores, both indoor and outdoor shopping centers. And with that, I am happy to answer any questions that anyone has.
Oh.
Philip, I think it was slide 5. You could put it back up that had the case rates per day on there, or per week that you just had up there. I got the question.
Yeah, yes, please.
Not that one. It was the colored graphic. There we go, right there. Up, no, back. There you go, right there. So, correct me if I'm wrong, but I'm looking at the first line there, rate of COVID-19 cases per 100,000 over 14 days. I thought when I first saw that yesterday, I believe, or heard it, that it was the rate case per 100,000 over 7 days. Was it 7? I thought I really did think it was 7. I read it. Now I see it says 14 on this chart. That's a substantial change.
Yeah, there was a draft early on where it was 7 days, but when the final document came out and was published and shared, it was changed to 14 days.
2 weeks.
Well, that's huge, right? I mean, because what that really says, I want to just put some emphasis on that. If you use the 7-day number that was announced, that was official as of yesterday, it was on the website yesterday. That means that we have to average 114 cases per day, less than 114 cases per day, average on a week, on a daily basis, in order to achieve that. By making this change, as subtle as it may be, that means that you need to have less than 72, 73 per day. No, less than, I'm sorry, I'm doing my math wrong. Half 114, 50, so less than 56 per day. So that's a big change. And it's just all too dynamic. This does not give businesses any certainty, and is another example of how things keep on changing. I mean, it's got to be absolutely, it's confusing to me. It's got to be confusing to other people when, they're gonna make decisions, and employees are at risk, tenants, not tenants, but patrons, businesses, everyone's at risk following these guidelines, and they just suddenly change without any notice. That's a huge change. So I just want to point that out. And amongst other things, I think that what we're hearing a lot from, especially in the news, about gyms, fitness centers, and so forth, who seem to be making the claim that they don't have any occurrences of COVID outbreaks. And so why are they being targeted, and why are other activities that are having outbreaks, different models or places where people congregate, where they are having outbreaks, yet they're not having any restrictions upon them? So it seems as though, I think people can make the case, and if this ends up going to court, then we'll see. I think some of it already did, but I think it puts us in a precarious position as commissioners to try to help our constituents, whether they're employees, patrons, or businesses, how we can position ourselves to make a logical argument out of something that keeps on changing. So I guess I have a question in here somewhere, and that is that, do you know of any cases where in Oregon where there is, for example, let's use the gyms, because that's the one that's in the news right now, where gyms, fitness centers are a source of outbreaks in Oregon? Do you know of any?
Well, my general response would be that when we have community spread like this, it's really hard to pinpoint the spread to say, yes, this is the source. I do think there is, some additional risk around gyms being open with people exercising, and it is challenging throughout shared indoor recreation to maintain physical distancing and wear the mask. And certainly, the intent of the extreme spread category is to really, it is a call to action that we have such significant spread in our community that we have got to take strong measures to help protect our most vulnerable and to protect our healthcare workers. And at the end of the day, I think that's the framework that this is coming from. Also, I understand your frustration around the 7 days versus the 14. I'll say that there was a significant push around the state. And Dr. President and I were part of these conversations with the OHA staff that were working on this, that there was a lot of frustration around differences from the school metrics and the reopening for businesses, and there was a huge push to make those the same. And so I think ultimately that is where that compromise came from in the final product that the governor presented last week. At 14 days per 100,000.
Yeah, well, I appreciate that. I think if there was a concerted effort just to standardize the days, then they could have made everything on the 14-day scale, but bump that to a number that it didn't double down on the threshold. Unless the goal was to put on to change the threshold. They did two things. They put it on a 14-day scale. I'm not sure which one you're referencing. Was there an effort to put on a 14-day timetable, or to just literally just change the threshold so severely?
Well, the school metrics had already been released last month, and there was a significant push to have them be the same, meaning that if school reopening of schools to in-person instruction is a priority, and that these are the two metrics in order to support that, that it should be in parallel with other sectors of our community as well.
All right, Sonia?
So, Philip, can you put a slide that has the extreme risk and that says what we can do? Let me just see. I am curious, what is an entertainment establishment?
For indoor entertainment?
It says recreation and fitness establishment, entertainment, max 50 people.
That could be an outdoor music type event, I would imagine.
Okay, so that's all outdoor.
Yes, that's all outdoor.
Okay,
So
that
outdoor
was one
recreation,
question.
outdoor fitness, and outdoor entertainment.
Okay, got it. So you can have 50 people outside, whatever. I mean, these types of things. And then I actually think these metrics make it way simpler to know if we're at where we are and what we can do. So when I first saw the draft of this a while ago now, I was pleased that, wow, we could do outdoor dining, and my exercise classes outdoors could resume. So I thought it was simpler, and I like that, but I'm just concerned that the other numbers on the other slide that you showed with us there's a little bit of discrepancy. Nancy, and I'm not sure what time frame we were at, but we were at 216 per 100,000. And then the numbers that you showed us on, I think, the next slide, if I could see that, or maybe the one before.
Yeah. So Commissioner.
So we were at 370 per 100,000. That's a substantial difference.
Yeah, Commissioner, my data is per week. And this is looking, I think, every 2 weeks.
Yep.
Okay, so that's huge that it's 370 per 100,000 for 2 weeks. So I mean, I'm just like so discouraged, because it's like, how in the world do we get this down? And then we really won't be looking at this for another 2 weeks to see if by chance all these measures worked and our numbers came down and we could go to a lower risk level. It will be every 2 weeks that we will be looking at that. Is that right?
Correct. Every 2 weeks, we'll be looking at this.
I would, at least from the business community, they would know when they will, I guess, but I mean, it's hard. I mean, this is a tough climate to operate in. I get it. It's hard. Yeah. So, one other question. So the metric that I like to look at is the number of cases traced to enforce. Are we still keeping those metrics?
Yeah, all the phase 2 reopening metrics that we have been sharing with the board on a weekly basis, we're still monitoring that and we still receive that data from Oregon Health Authority, but it's not a requirement for reopening and moving into these different risk levels.
But we will keep the data to know what we're not concentrating.
Yes, and we're happy to share that.
We know where we are now.
I
Because
can
those numbers,
look that up and send
when
that
our
to you.
numbers started going up with the hospitalization, those numbers went up exponentially as I was looking at the Oregon Health Authority.
Yeah, I can send that to Gary to share with the board. I don't have it.
Well, they might be,
easily
if those are in
available.
our situation reports, I can always just keep looking at it. I was just curious how this is going, but thank you. It's not really that great of news when you look that we have 370 cases per 100. But it is what it is, right?
Yeah, and you did mention appreciating seeing the what's allowed and not allowed. There is a really nice big matrix that Oregon Health Authority has created, and it's linked on our county website for all of the different risk levels and what's allowed at all those thresholds. Just for the presentation, we didn't share that because it's a lot on the screen to see.
Right. No,
is
and I
available
look
for everyone.
I looked at the draft, and so I've reviewed it. So what do you think? I know you don't have a crystal ball, but what are looking out there for the best science? Is we going to be able to get these numbers down, or kind of we're going to at this high level of cases? Going to keep going up? Are we going to hold steady? What's the science at this point?
Well, my thoughts are we did expect to see a fall surge, and we have certainly with social gatherings from Thanksgiving last week. We'll know in the next several days, couple of weeks, the impacts from that. I'm hoping it's not as bad as folks, all the experts are predicting. We'll see, but I think it's going to take significant effort for us to change these increases. I want to see us begin to flatten and start to move down. And we're not at that point in this moment. I hope that we can make that shift as a community.
And are these metrics expected to last and continue to increase in cases, or will there be expected more restrictions?
I think the governor's office is really hopeful that these are the metrics for schools and reopening businesses and that they'll stick to them. We'll see. There's been a lot of changes this year. So the crystal ball on that one's hard to predict, but I think that is their intent.
Thank you.
Paul?
Yeah, I was gonna ask Gary, is this a good time to talk about the town hall idea again, about having town halls on COVID? I mean, I'm just gonna tell you, after a conversation last night, I gave that person the latest, hottest data. And if we had done that as a board in a town hall, and then this morning we find out that that's all up the window and the threshold was just was literally doubled. It puts us in a difficult position, puts staff in a difficult position. And yet these are metrics that are established by the state. If anyone ought to be doing a town hall to the public, it should be the state. It shouldn't be us. I'm just very concerned that the information we get everything is so dynamic. I'm not attacking the state. I understand how dynamic this is and how dangerous everything is, but I just don't see how, if it's wise for 36 counties, for example. I'm not saying 36 counties are proposing this, but why each county should be doing or presenting this material when it's state. The state should be doing this. I just don't see the logic or the rationale or the purpose and the benefit to the community if the data is changing so swiftly.
Yes, this is a good time to discuss this. So we did discuss this with you a week or two ago, commissioners. It was Chair Bernard's original idea. You were open to the idea. There is no time that all 5 of you can attend. So first I'll tell you that. If we do this, it would be probably 2 of you at a time if you wanted to do that. But Commissioner Savas is right. This is a state decision. It's not yours, ours, and it changes constantly. So do you still want to go forward with these town halls, knowing it will probably be 2 of you doing them, not all 5 of you?
So I'm interested because people want somebody to talk to. And they want us to listen, and I'm willing to listen. I wanted to just mention Philip, Dr. Present, and Nancy and our partners in the metro region really worked diligently to get the governor to make some adjustments to these metrics, and were successful. And I think that's important, but I am here to listen to the public and provide them an opportunity to speak their concerns. Not that we could do anything, but actually I shouldn't say that. Not that we don't have some influence, we do. And we've made those changes and changed these metrics based on the hard work of Philip and Dr. President and Nancy and our partners in the rest of the county, Tri-County area. So, you don't have to attend. I'm interested. So, Paul?
I'm just wondering if this did come from the Tri-County chairs, if that it sounds maybe it might be wise to make sure that the information that's provided is coming from our experts, whether that's Philip or Dr. President or Nancy, whoever they may be. And what if the Tri-County chairs actually hosted the town hall and had all of their professionals, ours included, be the ones that are answering those questions and give the public the opportunity that you're seeking, Jim?
Well, I think that the Tri-County chairs are doing their own. I know
Well,
Washington County's looking at it, and I know Multnomah County's looking at it, but that's a hell of a lot of people that, you've seen one county.
Yeah, but these are state issues. They're not county. I mean, they're impacts to everyone around the state, but they're the same impacts, the same kinds of businesses. I just want to make sure that this is staff that are they're feeding the public the information and answering the questions, and it's not us.
All right, so Ken and then Sonia.
I think the idea of having professional staff on a town hall would be an excellent idea. Let them answer the more direct questions of the what's and whys. That's what they're in the business for. But it is an opportunity for us as commissioners, whoever attends these meetings, to also make the point that things change because it is dynamic. They're learning about a disease that they knew nothing about a year ago. And so as they learn more, the metrics and things do in fact change. And it's also an opportunity for the board, the commissioners, to make the point that in the final analysis, this is about a social contract that we all have towards one another. And it's not just about obeying the governor or any of the rest of that, but recognizing that any of us can have a negative impact on the health of others if we don't pay attention to the social contract that we have as human beings in this county and in this state to try and prevent the spread of this disease to other people. And we can use that conversation to emphasize that point.
Okay, Sonia, and then Paul.
Yeah, I'm interested in having the town hall. I find that the best information we get are from our residents in Clackamas County, and being armed with their direct experience for when we're in all of those places where we can advocate, whether it's with our fellow county commissioners from around the state or with the governor, with our legislative delegation, knowing firsthand what is important to our constituents is really important. And I think we do have influence. I think a lot of how the metrics are that we're tethered to Washington and Multnomah County because of our advocacy. And I honestly think we are very different than the other counties. I don't think that having all of us put together as what the impacts are is the right approach right now. I think we need to listen to the people that live here in Clackamas County, and it will help inform us. And as Philip Crystal Ball has indicated, we'll have these metrics for a while. They were designed to last throughout, hopefully till we potentially have a vaccine. How are we going to construct our lives and live within this construct? I think is really important to know where the strengths and weaknesses are within this.
Can't hear you.
All right, Paul and Martha.
Well, so now that we're on this topic, so is it, they was proposed to have 3 of them. There's only like 3 weeks before the holidays, frankly, before Christmas. essentially, that are fluid. So are you still of the mind? Are we still in the mindset that we're gonna have 3 of these, which
Not
sound like they're
necessarily.
gonna be redundant, or just one?
Not necessarily. Well, one with the Latino community and one with whoever wants to go on. Time is short. We're just trying to get something in for the holidays. Hey, Martha?
Yeah, I'll tell you my overall concern, and this isn't reflective on our professional staff, but what concerns me about this, as someone who's been trained in science, all these changes seem to be more based on political negotiation to me. And I find that very concerning. Okay, the metrics are basically seclusion, wear your mask, do all the public health things. And if you don't follow them, you're going to have an increase. But changing, when you can go to a restaurant and all this nonsense, I'm like, maybe I'm just voicing my frustration. But it just seems to be, we need to be as closed down as possible if you're going to stop the spread. And all these other negotiations don't seem science-based to me at all. It's just trying to find that middle ground. If you want to stop the spread, don't go to a restaurant. If you want to be safe, stay at home. Don't travel. That's the only isolation, is it? I'm sorry. And all these metrics negotiation, I'm very frustrated with what I see as a constant moving of the bar when it's very straightforward. This is epidemiology. This is a disease. There's standard ways to handle it. End of discussion. Sorry for the rant.
So Martha, I'm sorry, but I disagree totally. These are science-based decisions. Our Philip, Dr. President, and Nancy are not on the phone trying to talk about politics. They're talking about science. It's true.
That's why I said to you, this is not about our staff and the people that are doing the science.
Well, I know. So
This constant moving of the bar at the state level, in my opinion, which seems totally inconsistent. And the bottom line is we're going to follow those metrics, but the governor is not a scientist. Sorry, she's a lawyer.
So not everyone can stay home, not go to restaurants, and not do these things. Some people do need to go to a restaurant to eat. People can't always serve themselves. They need to go to restaurants. These aren't political decisions, and the governor, frankly, it doesn't appear to me to be making them. I'd say in the beginning they were, because we didn't have the data, but today I don't think they are. I don't want to put it on Philip's back to answer that question, but I believe it's true that these are science-based decisions, not made political. Certainly, I think the governor took the advice of the counties, eastern counties that are still healthy. Tillamook County, for example, has had very few cases and now has actually divided, separated the counties so that counties that are less impacted can do a little more than those that are heavily impacted. And I think that was a decision that was really appreciated. And we'll see what happens in like Tillamook County, for example, how that goes. So Paul, and let's try and finish this up and move on. We got lots to do today.
Yeah, I'm certainly not going to argue the science, but I think you need to also be cognizant that those that are in the science are learning about this. We're in the learning mode. They don't have all the answers. So it's not as though these are perfect decisions, and I don't want anyone to think that we're making perfect decisions. If we were, we'd have this thing under control, and we don't. Also should be recognized that we're losing, it sounds like, and I'm not saying we, Clackamas County, but the state or this country is the impacts or the effectiveness of contract tracing seems to be just diminishing because of the rate of the cases are just so overwhelming. So as these cases become more sporadic and we're seeing people, at least I am, and I know everyone I'm talking to, anywhere anyone goes, they're seeing people with masks on. So masks are not the only answer. I mean, it's not a guarantee that if you wear a mask that somehow you're not going to get COVID. It's still spreading. So we got to realize that it's extremely dynamic, and I just want to put that out there that it's not that anyone's questioning the science so much as we are also learning, and we're losing. It sounds like apparently, say we again, the country, the world, whatever. We seem to be losing grip. The fact that it's spiking as much as it is, we are losing control. We're not really sure exactly how to get this under control.
All right, I don't see any other questions. Turn over to you, Gary.
All right, so to confirm on the town halls, we're going to do 2 town halls in the next 3 weeks. We'll invite all commissioners to attend, but of course, it's your choice if you wish to attend or not. So that is still the plan moving forward. We'll move on. Thank you, Philip. Nancy, I'm going to jump ahead to your item so you don't have to wait. Emergency operations plan promulgation letter. Sorry, I didn't say it right. Nancy, can you please update the board?
Yeah, thank you. So yeah, we're asking that we can extend a promulgation of the emergency operation plan until March of 2022 at the latest. The reason for that is we did start our update of our plan here in January, and it takes a year to do a really good update of the plan. And as we just were getting started and kicking off, COVID hit, which brought all of the staff and anyone that would be working with us on the emergency operation plan, were not able to do that. So for a couple of reasons, we really want to do a good job because it is a legal document. It is really important to have the best document that we can. And we need time to work with our partners, our other county departments, and also have enough time to take it to the public so that they can do a review as well and give comment. And we also want to make sure that we get through our after action reports for both COVID, which we have done some on already, even though it's not done yet, and the wildfire, and we can get all of that information into the new plan, which will make it stronger going forward. So we're just asking for that year extension on the promulgation letter, and so we can just do what we need to do to get a new emergency operation plan update.
You need a motion?
Yes. And
So
there's a-
moved.
And there's a draft letter in your packet.
So moved. It was seconded. Any
Second.
further discussion? Christina, please poll us.
Commissioner Fisher,
Aye.
Commissioner Humbertston,
Aye.
Commissioner Savis,
Aye.
Commissioner Schrader. I see your eye, but you are on mute.
Aye.
Perfect. And Chair Bernard.
Aye, motion carries unanimously. Thank you.
All right, thank you.
Nancy.
All right, thank you, Nancy. You're done for today. Thank you. Next, COVID-19. So one last COVID issue, COVID-19 Digital Public Engagement Initiative. We have Sue Hildick and Kimberly Dinwiddie from Public and Government Affairs. To give you a very, very brief update, there was a packet or an update in your packet of this proposal. So as soon as they're here, Sue and Kimberly, please go ahead.
I'll jump in. Hi, everybody. So the conversation you just had is a perfect segue into a new tool we want to put on the table around public engagement and public awareness. The COVID event, as you know, has largely been one around public information and engagement. I mean, we've had to really get information out and rely on people to take action. And people are tired and there's fatigue. So we have what we think is a creative approach to try, which Kimberly will explain. It's basically a partnership between PGA and the EOC. And it is targeted at the 20 to 29-year-old population and businesses. and we are paying for it out of federal CARES dollars as a public engagement campaign. So Kimberly, do you want to walk through it?
Sure. Good morning, commissioners. For the past several months, 20 to 29-year-olds in Clackamas County are getting COVID-19 at a higher rate than any other age group. And as a result, our new approach, which is more of a COVID quiz, is geared towards county residents within this age group. And so to reach this group, we are going to rely primarily on social media through various platforms starting Monday, December 7th. While we'll also reach out to traditional media outlets, a bulk of our engagement is aimed at where our audience is, and that's on social media. And as we've discussed, businesses also play a vital role in keeping the community safe from COVID-19 while still keeping their doors open. And so we've included a section in our COVID quiz for businesses, and we'll reach out to them through our existing channels that we use to communicate with businesses. We're still tweaking the look and the feel of the quiz. The questions will remain the same, and you have received a copy of those questions earlier. And there's 6 questions for individuals as well as 5 questions for businesses. And we're working on translating the quiz into various languages to ensure participation across all populations within the county. The quiz will rate individuals and businesses based on how closely they're following safe COVID-19 practices. And at the end of the quiz, they'll receive an overall score on how well they practice being safe, and they can share that score with their friends on social media. We're offering incentives for people to take this quiz. The first 2,000 participants will receive a Clackamas-inspired face mask. It's still in design, and we're finishing that up today. And they'll also be eligible for a raffle to win a gift card that supports a local business. So the quiz response will be anonymous, but once we know the response, we'll share the overall response from the quiz online with the media, as well as our state leaders and public health officials to highlight Clackamas County's leadership in protecting COVID-19 or protecting the community from COVID-19.
Our goal, thanks, Kimberly. Our goal is that 5,000 to 6,000 people would take the quiz and start to do more, to use more safe practices around COVID. As we roll this out next week, we'll ask if you will push it out through your social media platforms as well. That'll be our primary way of engagement. And all of our public health leaders in the EOC have been involved with the quiz, and we'll be looking at the masks to make sure everything's really safe and solid as we put it up. So we wanted to make sure you were aware, and we'll be sharing the final materials with you before they go live in probably a few days.
Any questions? Sounds great.
Okay, thank
Forward
you.
to it. Thank you.
Thank you. I'm going to shift the schedule a bit here. Next, bring in Greg Geist, Tri-City Outfall Project, Alternative Delivery Procurement. Again, there was a memo in your packet. Greg will give you a brief update on what the request is. So one moment here while we wait for Greg. Greg, go ahead, please.
All right, good morning, commissioners. Christina, we're going to need to bring in Lynn Chacoin and George Marlton if he's available. If George isn't there, then Amanda Keller. All right, good morning, commissioners. What I have today is a preview of an item that is going to be coming before the board and hearing on the 17th. It's related to our Tri-City Outfall Project. As you recall, that was approved by the voters in early November. And now it's time to prepare to design and build that project. Because of the nature of the project, which Lynn will describe here coming up next, we think that an alternative delivery method, specifically progressive design build, will be the most advantageous for us and our ratepayers to get the project delivered. So yeah, Lynn will talk a little bit about the project very briefly, and then I believe Amanda will explain the procurement process we're embarking on. Thank you.
Great. So I think I'm sharing my screen, but I can't see it. Can you?
Yes.
Perfect. Perfect. So quick reminder that on November 3rd, the citizens of Oregon City approved a easement through Johnstone Park for our outfall. And if you remember the route of the new outfall, it goes from the Tri-City treatment plant along the 205 and then into the Willamette River. The pipe will be constructed as open cut from the treatment plant about to Main Street. And then our plan is to sink a tunnel in probably the cloverleaf of the 205 and 99 intersection and tunnel back towards Main Street and into the river. It's very complex. And what we're wanting to do is get approval to bring on the contractor during the design through a procurement method called progressive design build, so that we can get expertise of specialty contractors during design. We did some preliminary geotech work. This is just to show you that it is complex, and the type of soils we have to go through dictates methods. And we want to avoid boulders, which can be anywhere, but will be especially in this gray layer. So we know that so far, but there's a lot, you can't see underground, so there is risk involved. This is to show you what kinds of machines we'll be using to bore what is probably a 10-foot tunnel, both back towards the treatment plant and into and under the Willamette River. So I'll let George explain, or Amanda explain what is involved in the progressive design build process. But on December 17th, we're going to be coming to you to ask for an alternative delivery approval so that we can have a contractor help us with design of this project.
Thank you.
So just addressing the process in the short term, the hearing on the 17th is for the board to approve findings. And so this process is identical to any other type of alternative delivery. And I think you've seen CMGC before, so it'll be the same factors that are identifying the benefits of this type of project delivery. So you will see a resolution and those findings before you on the 17th, and we will be publishing a notice of that hearing and the making the findings available, I believe, today or tomorrow. So I think that's it. Are there any questions about that process or what might be coming before you?
Yes, Paul.
Yeah, well, Lynn, you touched on it. My concern is, going through this area is the rock claws, that just the terrain, if you will, the geotech stuff and what's underneath there, and knowing that this area is, well known for just that kind of a challenge. So I guess number one, I think obviously having, goes without saying, but having people with the expertise, but also having people with the expertise and experience with the rock claws or whatever that is, and so that we're not really stuck out with an open end. And so from a legal standpoint, I want to make sure that we have every precaution in place to protect the financial interest of the district in this project, so that we're not subject to an open-ended situation where we're just literally paying exorbitant extra cost. And certainly I would say that knowing and having this discussion that they're not unforeseen, these are foreseen challenges ahead. So any kind of, can you add anything to this and how we're going to protect ourselves?
Well, by using this method, it is a way to protect ourselves. If we would do conventional design bid build, the contractor, builds risk into his price. But if he runs into something unforeseen, then the risk is all on us. By having the contractor help us with design, and we will mitigate those risks as we go.
So what's the range of what's the estimated cost for this project?
21 to 25 in the 20 millions.
Okay, so is that variable range of $4 million, you know, to cover the unforeseen, or is there any protection that it's not to exceed? Is there any not to exceed language anywhere?
We will be getting a guaranteed maximum price as part of this. That will be developed later in design after the contractors had a chance to be part of the process of laying this project out.
And the approval of that GMP will come before the board, so you will all have an opportunity to review it and opine.
Okay.
All right, so I don't see any other questions. I have a comment, however. You know, I've been working with Metro on a effort to get BIPOC communities involved in these kind of projects, some of them as subcontractors or contractors. So I hope that Clackamas County in the future will make an effort to get Black, Indigenous, and people of color involved in projects like this. Sometimes as, you know, there's probably not a lot of big companies out there, but certainly as subcontractors or as the contractor. So I hope that's going to be part of Clackamas County's future effort.
Yes, it is, Chair Bernard. We're in the process of making that happen.
Thank you. Appreciate it. All right. I don't see any other questions. Thank you, guys.
Thank you.
So you need a motion? Or is that going to come
No
up?
motion, it's just a heads up for you today.
Thank you. Great.
Thanks.
Thank
All
you.
right, thank you, team. Now we'll go back to the prior item, Data Cloud Solutions Procurement for the Assessor's Office. We'll bring in Bronson Ruida, Lynn Longfellow, and Elizabeth Comfort for this one, please. There's a memo in your packet as well. We'll wait just a moment for the transition here. All right, Bronson, why don't you get started, please? Give a high-level overview.
Sure, Gary, thanks. I want to point out, I think Tammy is also in the queue. Oh, there she is. Okay. Thanks, Gary. Good morning, Chair Bernard, commissioners. Thank you for taking the time today to discuss our issue. My name is Bronson Rueda, the Deputy Assessor with the Assessment and Taxation Department. With me is Tammy, the Assessor, and the Appraisal Manager, Lynn Longfellow. We're requesting that the board sign the Data Cloud Solutions contract today, which has already been signed by the vendor and by Clackamas County Legal Counsel. If approved, this will be a software as a service purchase on a 4-year contract. Now, you should have received a memo containing a high-level summary of how the pandemic has revealed a need to revise some of our current business practices. In particular, moving our annual valuation program from a paper-centric process to an e-centric process. The memo also highlights benefits of the Data Cloud Solution software and outlines the 4-year contract cost. We anticipate the installment costs will be reimbursed by CARES funding. The yearly maintenance costs will be included in our annual budget going forward. Again, we're before you today requesting the Data Cloud Solutions contract be signed today so the vendor can start working with our TS department on implementation before the December 30th deadline to qualify for CARES funding. Are there any questions?
Actually, I'm going to ask you, Bronson, so explain why this is happening in issues. Why is this not on a consent agenda?
So good question, Gary. We've been, from our perspective, we've been following the process all along, working with procurement, working with TS, working with all the departments, working with the vendor. And it's our understanding that the procurement department has been overwhelmed with requests. And so ours didn't rise to the top until we were alerted by our potential vendor stating, hey, we need to get this done by a certain date, otherwise we won't be able to implement it by December 30th. And so we let procurement know the vendor needs it by this date, and that's what elevated it to today.
Elizabeth, you want to add anything to that?
Yeah, it is not an emergency situation, but it is beneficial if we can have the implementation done prior to the end of this fiscal year for a financial benefit, but it is not an emergency.
Hey, Paul?
Yeah, whenever it comes to software and technology, you got to ask the question, and that is this a proven software? And has the vendor got examples of success? Somewhere. It seems as though, as we know, that some of these software programs sometimes don't perform, or maybe not scaled to a organization buying a large organization versus a small organization. And of course, governments have taken hits for missteps along those lines. I don't want to be one of those examples. So my question is along the lines of how secure are we? Not only is it a loss of money, and it's not that much money. I mean, still 300, looks like 324,000 about, or in that neighborhood, but more so that if 3 years are lost discovering it doesn't work, you've lost a lot of time and effort, and that's a setback as well. So it's got major implications if the software is not a proven technology.
Sure, Commissioner Savas. So the vendor Data Cloud Solutions is a national vendor that has worked with many municipalities and government agencies such as ours. And in Oregon, Yamhill County implemented Data Cloud Solutions in 2017 and has reported great success and efficiencies. And I don't have the exact efficiencies with me right in front of me, but if you want, I can send you their information. And on top of that, Deschutes County recently completed a pilot project with Data Cloud Solutions, and that was successful. And they have gone forward and signed a contract with Data Cloud Solutions to have their whole office working with the software. And so I personally did extensive research with this vendor to make sure that all of our, that it would be a success. And all I've revealed is good things from this vendor.
Okay, so both those counties you mentioned are smaller than ours. Are there any examples of larger counties? Again, a scale, I think, sometimes softwares can only has a certain capacity. I just want to make sure we've touched on that as well.
Right, so the only larger counties than us are Washington County and Multnomah County, and both of them have different CAMA solutions, different core systems. And so those core systems have their own software that is going to do something similar to ours. Our CAMA system doesn't have this software. That's why we need to go out and get it ourselves. And so Deschutes County, even though they are smaller than us in a lot of different ways, they are compared to us when you're comparing county sizes. So Deschutes, in my opinion, is a good example of a county that has implemented this software successfully.
All right, well, any further questions? I don't see any, so entertain a motion.
Move to approve.
Second.
Second.
All right, it's been moved and second to approve. Christina, any other discussion? Christina, poll us.
All righty. Commissioner Fisher?
Aye.
Commissioner Humbertson?
Aye.
Commissioner Savas?
Aye.
Commissioner Schrader? Oh, I don't see Commissioner Schrader. Might have lost her. Okay, Chair Bernard.
Aye, motion carries 4-0. All right, thank you guys, appreciate it.
So here's what I propose, commissioners, because this is outside your normal process, but because of the deadline and because we don't want to lose CARES dollars, you authorize this to be signed today, December 1st, which Chair Bernard will sign, but I'm going to put it on your consent agenda for this Thursday for the record as well, just so it's formal. I respect staff and all you do, but really we should have had this done on the consent agenda, but we're flexible and we're getting it done today. So that's the process we'll follow, just so we crossed all the T's and I's and dot, all that stuff. So with that, thank you very much. We'll move on back to the list.
I'm in the office now if somebody wants to bring it up.
Thank you.
Yep. Okay. Very good. Next, back to the list. Project leadership team appointment for Oregon City Westland Bike Ped Crossing Project. We have Karen Burig and Scott Holschler from Transportation and Development to update you. There also is a memo in your packet. So we'll wait for the room to load here in just a moment.
See, we are all here.
All right, Karen, why don't you go ahead, please?
So I'll go right ahead. So we had a request from ODOT, who is spearheading a project for the Oregon City to West Lynn pedestrian bridge project. And Scott Holscher is the staff from our department sitting on the technical group and the project management team. But the project is looking for an appointment of one of our commissioners onto the project leadership team. So the project leadership team consists of some key decision makers from Clackamas County, Oregon City, West Lynn, Metro, and ODOT. That's who's on the project leadership team. They anticipate having 3 project advisory committee meetings, and there's potentially 3 additional contingency meetings. The meetings would happen between January of 2021 and go through May of 2021. This whole project is scheduled to occur in the first 6 months of 2021. So Scott, do you have any additional information about the project itself?
Sure, yeah, just a little overview on the project. It is a project that's being led by ODOT that is just underway. That'll extend until June of 2021. So this is a project that is looking at a feasibility study to consider a new bridge for pedestrians and bicyclists across the Willamette River. So it would not accommodate automobiles. It's strictly for pedestrians and bicyclists. This location would connect Oregon City and West Lynn. The study area is roughly between the I-205 Abernathy Bridge and the Willamette Falls Legacy Site. And there is a map showing the study area with other projects occurring in the area as part of your packet. So this project will look at potential alignments for a pedestrian bicycle bridge across the river. And ODOT is considering 4 to 5 potential alignments that'll be considered as part of this project. And one option that is part of this effort is to consider the closing of the Oregon City Arch Bridge to vehicle traffic. There isn't funding for a bridge construction at this time, so this project is strictly looking at really 2 questions. Is a bridge feasible in this location? And if so, what would be the alignment in the landing points on both sides of the river? So that's really a brief overview. There is actually a 2-pager document in your packet that provides more information, but that's kind of a quick high-level overview of the project.
Paul, we don't need to spend a lot of time on this. I think you 3 guys should decide which one of you are going to be on it. I can guess who might.
I just wanted to add that this is kind of brought on. This has come up in our C4 but our C4 subcommittee has come up at a number of other committees partly because of the I-205 Abernathy project, and there has to be a safe bike ped crossing, and so they're trying to find something feasible. So it's intertwines with a lot of the activities we're doing. So I just wanted to say that, this is a concept of sorts, and they're looking for ways of accommodating that bike ped need for that project.
Sonia.
Well, it seems to me like the current bridge right now, can't pedestrians and bicyclists go over that bridge?
Not safely. It's not very wide.
Okay, so it's not safe. Okay, that was just my question. So I'm good with Paul continuing to be our liaison. Martha, are you good with that? Yeah.
All right, Paul, you're it.
Okay.
Great, thank you very much.
Thank you.
Thank you. Thank you.
Great, thank you. Moving on, next, North Clackamas Parks and Recreation District Intergovernmental Agreement between the City of Milwaukee and NCPRD for the Milwaukee Bay Park Project. We have Laura Zentner and Heather Cook to discuss this. This was on your consent agenda last week. Commissioner Savas asked that it be pulled for more background information. So we have staff here today to answer your questions, and we'll start with Commissioner Savas. And if that is satisfactorily answered, we can put it back on the agenda. But first.
So let me start though, Gary. So we are now sitting as the North Clackamas Park and Recreation Board.
Yes, thank you, Chair. All right, so
Yeah.
perhaps Commissioner Savas, if you'd like to start with your questions, and then we can answer.
Well, yeah, so there's a couple moving pieces about this, and Gary shared some information with me this morning that I did not know or was aware of exactly per se. So I just want to say that, number one, there have been concerns raised about the Concord project, which I brought up on Tuesday, with regard to, number one, process, number two, questions that the DAB had asked and wanted some involvement in, and it's spelled out as a requirement in both the IGA with Milwaukee, and it's also spelled out in the bylaws that there is a role and a purpose for engagement. Those have not happened on the Concord project, and they have not fully happened on this project as well. So therefore, there's a process element that needs to be addressed. And I want to make sure we're dotting our I's and we're crossing our T's because of questions that have been raised from both sides or parties or whatnot, if you want to call them that. I think what Gary expressed to me was that what was on the agenda on the consent agenda was simply a means to accept the funds, and which if it was narrowed down to that, I'm totally fine with that. But there's other elements that are in the packet that were questioned before, and I didn't want to anyone to be conveyed that somehow those unanswered questions and discussion and process were going to go by the wayside, and suddenly this was going to all be handled in the consent agenda. So if the staff proposal is simply narrowed down and modified to just accept those dollars for this project, I think that simplifies a number of steps, and we can work harder to get the other processes and requirements taken care of at a later date.
Laura or Heather, could you answer that or respond to that, please?
So the current IGA as written is simply an agreement to accept $1 million from the city of Milwaukee to North Clackamas Parks and Recreation District. The IGA can be canceled at any time. It doesn't bind us on any future funding regarding the project. And again, it's just simply to allow us to accept the dollars from the city of Milwaukee. We will have future discussions on how we fund the remainder of the project, such using SDCs, Metro Local Share, and grants. And once the DAC, the District Advisory Committee, is up and running, we fully intend to have everything go through the District Advisory Committee, as well as the Board of County Commissioners acting as the insecurity board. So I think as it's written, it's currently just simply that agreement.
Yeah, but there is in there, Laura, the funding matrix, which a lot of those elements have not been discussed or agreed upon in questions answered about that. So if that could be, if the word draft can be put on there or something like that, because I think that is what has created a little bit of concern. And in a much greater extent, the Concord project, virtually none of that has come before the DAC or DAB.
We can put a draft wording on the funding, because it is all just proposed funding. Again, it has a lot of pieces of it have not been discussed, so we're definitely willing to do that.
Yeah, if you could do that and add language that says just what you said, that these are proposed, and I think that would help, frankly.
And Commissioner Savas, to your point, there is nothing in the IGA that specifies the amounts. So the funding plan is, referring to that as a draft is actually quite accurate. It's a constantly moving, version of how we're going to get full funding. But I think there's specifically not any amount in the IGA except for that which will be transferred from the city to the to NCPRD.
Yeah, and I want to just spell out, I'll make it perfectly clear that on Tuesday, when the Concord project was presented, you had a number of dollars that would be committed by NCPRD that had not been discussed. And it didn't really say proposed in the sense that, so there needs to be, I think, a clear path to us, number one, spelling out that there will be a process. We will be meeting the requirements, the IGA, the requirements of the DAB. I mean, all those things that involve the district. And I've just been, there have been, there's history of where we haven't met all those, frankly, and that's the concern. And that has been a major issue that needs to be resolved.
Okay, we will definitely mark the funding sources as draft and make sure we take care of that and then put it on the agenda for Thursday. Is that what I'm hearing?
Yes.
On the consent agenda?
Well, Gary, did you mention December 10th to me yesterday?
No, that was for, I thought, the Concord items originally, but I
Okay.
think I may have misunderstood that.
Yeah,
No,
if you could fire that draft language out there to which you're gonna put in the packet and put it out as a revised agenda, I'd appreciate that.
Okay, we'll do that.
So can we add this back to the agenda for this week's business meeting?
We can do that.
Bernard, can we do that?
Yes, Ken has a comment.
Well, I have 3 questions, but at this point, I'm not sure exactly how they relate to where you seem to want to go on Thursday. So I would like to speak to Laura offline after this meeting is over. If you would give me a quick call,
okay,
I can ask my questions at that point in time, and that may resolve my problem.
Okay, we'll do that.
Thank you.
All right, great. Yeah, I'll put it on the agenda.
All right, we'll make these edits and add it back to this week's business meeting agenda.
All right, next item.
Great. So now, Chair, you're back to meeting as the Board of County Commissioners.
Yeah, we will reconvene now as the Board of County Commissioners. Thank you, Gary.
Okay. Next is advisory boards and commissions, and this is the audit committee. It's a chance for Chair Bernard and Commissioner Savas to discuss the interviews you held for these candidates, and then if you're prepared for the board to make a decision today. Christina, do you want to tee it off though with the names, please?
Yeah, definitely. So we have one ABC for the day. It is the audit committee staffed by the finance department. They currently have 1 opening. They received 4 applications and are recommending Kathleen Turner for her first term.
So moved.
Second. Further, Paul?
Yeah, I just wanted to state that when this new seat was added, that the discussion was adding a citizen seat. And my interpretation of that is that, or belief, that's a personal one, that the citizen seat, whether it's the budget committee or audit committee, when it comes to finances, should be as far removed from government as possible, but obviously having the experience to be able to do the work and understand the numbers. So all of the candidates were well qualified. This Kathleen Taylor has an exceptional experience level, but she's very tied to government, works for government. So that is the only thing. And I think she went out of her way at one point to even stress that number one, she's got a relationship with the auditor, which is not a bad thing. And she works for government. So it doesn't fit my personal belief that being far removed. The gentleman that lives in Wilsonville is private sector, has experience on budget committees, and was my preference is at least fitting my ideal of someone having the experience, but yet being as far removed from government as possible. So I will happily support that, but I just thought that I was anticipating the conversation would be not having a staff recommendation, that we would just actually talk this through, but it's not a big deal. I just think that, again, having someone far removed from government is a better thing.
Oh, I think the expertise of this woman was outstanding. Until she started speaking, I wasn't sure where I was going to go, but wow, she's going to be a great asset. Anyway, so it's been moved and seconded. Sonia.
Thank you, Chair Bernard. So I reviewed all the applications, and one thing that really stuck out to me was, why do you want to serve on this committee? And the answer that I really appreciated was Kevin Moss's answer. And we all know Kevin because he worked with us. But his expression of really wanting to serve the community, I thought was really important. The other applicants was more about wanting to learn more about Clackamas County. So that's my only lens, that one's motivation to serve, I think, is important. I don't know the other candidates other than Kevin. The one piece that I did want to throw out, I did notice that the Kathleen, and it's Taylor, not Turner, for the record. I just want to clarify that or correct that because Christina said Turner, is also from Lake Oswego. I believe, is Sean Caldwell also on the audit committee? So there's not the diversity of location and geography for the audit committee. And I don't know as a whole what qualifications, if Kathleen's qualifications are similar to Sean Caldwell's qualifications, my interest would be to have more diversity. But I wasn't on the interview committee, and so I really appreciate Commissioner Savas and Chair Bernard, you both participating in that, and I give deference to what recommendation you might have. But those were just my thoughts to discuss. I don't know, Commissioner Schrader has some thoughts about this.
No, I'm okay.
All right, Christine,
All right.
please poll us.
Commissioner Fisher,
Aye.
Commissioner Humbertson,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries. And please reach out to Kevin and have him apply for any committee he likes. He's a great asset to the county. He just wasn't real clear on what the audit committee's job is. So, and I think the experience is really important. So, thank you. Next item, Gary.
All right, next, your business meeting agenda for this Thursday, December 3rd. So first, we're adding 3 items, 2 of which you talked about today. One is the data cloud procurement for the assessor's office. Second is Milwaukee Bay Park. We'll add both of those to the consent agenda. And something you discussed in executive session, we are adding the vacation carryover proposed code change for 1 year only. And that will be a public hearing. That will be added to your agenda for this Thursday, in addition to what we already published. You have a previously approved land use issue, 2 other public hearings. One is on the tax financing for the tax exempt bonds for Health, Housing, and Human Services, Caritas, which you discussed a few weeks ago at issues, and a resolution on a Clackamas County supplemental budget for the current fiscal year. And you have several consent agenda items. So I am asking, with great respect, commissioners, please give me more notice than the morning of the business meeting if you have issues or questions with any of these topics, so that we can answer them for you prior to Thursday morning. Please, I'd love to help you do that. With that, that is the update for the meeting. Finally, Commissioner Communications, up to you, Chair Bernard.
Who'd like to start? Paul?
Well, I'll just go ahead and start so I can actually just address Gary's comments. So, Gary, I've been a commissioner for 10 years. I rarely pull anything off the consent agenda for discussion, but we had two unusual things happen. Number one, wasn't available to have our Monday morning talk. And last week was a compressed week. So, and there was a lot of stuff that we had on the table. So I had little time. And also my staff person was also out. So there were a number of factors. So there are times when it becomes necessary to do that. So
I was not referring to you alone, Commissioner Savas. I want to be clear about that. Many
I know.
have done this. That was just my request. I'm here to serve you. Thank you.
I get it. Today, the OTC is meeting today. It's kind of a big day. So I might pop in and out of the remainder of the afternoon, trying to pop in on some of these discussions that are going on transportation. We are in a very interesting time. The state is moving pretty aggressively, COVID or no COVID. They're moving pretty aggressively forward on on tolling in significant ways. So I'll keep you all apprised as it happens. And also there's a big push, just so you all know. As you know, the rural areas of Clackamas County, or rural citizens of Clackamas County, were the people who actually helped create or found essentially the Region 1 Act. They reached out to not Commissioner, but State Representative Kennemer at the time. He lobbied for 2 or 3 cycles, and Oregon put an Oregon consensus effort forward to form an act. So it was the rural areas, because they weren't getting much in the way of dollars. Since the R1 Act had been formed, we didn't really get, I thought, really a proportional representation as much as it could have been, and is overwhelmed with urban kind of interest and urban votes, if you will. So we had a meeting last Monday evening, not last night, but the Monday before. Saw the letters. Concern, I think, is still going to be that the rural areas are going to be potentially impacted by a push for a number of urban type projects and possibly potentially and likely at the expense of the rural areas. So I just want to bring your attention to that. And if there's a need for a phone call or 2 or some advocacy from my fellow commissioners, I might be asking for that in days, weeks, and months ahead. So that's what I have for today. Thank you.
Sonia, how about you?
I just want to let folks know that the Metro Oversight Committee is in the process of doing its onboarding of the Oversight Committee members. And the first meeting consisted of really just sharing what interest is on the committee, a lot of background as to the measure to get everybody up to speed, and kind of what the purpose of the Oversight Committee is. I did want to give an update. The last time I updated everyone, it was my understanding that Dan Fowler would be sharing the position with Portland Business Alliance's requested person, which was John Mayer from the Oregonian, and Emily Klepper did get that in writing from Metro. But when I had a meeting with Metro staff about the Oversight Committee, I was told that that wasn't going to happen. There wasn't going to be any alternates. So I am in the process of figuring out, I guess PBA and Metro are doing some other agreement, which I'm still trying to figure out. And once I have that figured out at the next issues session, I will let you know. But I just wanted to correct what I stated to everyone, that is not happening. And there we go. So Commissioner Schrader, what we will need to do is to share this effort, since they aren't having alternates, having anybody step in if someone cannot attend the meeting, is to just make sure that we are staying connected, that we do our check-ins so that we can strategize any issues, and to make sure that you get on your calendar when these Metro Oversight committees are, so if you're able to listen in and be engaged. But at this point, honestly, it's you already know the background of the measure, what all happened. It's probably not the best use of your time, this onboarding process.
I actually talked to Tracy. I don't know why it wasn't on my calendar. It was no big deal. And my intent is just to listen in.
Yeah.
So I don't have any worries with.
Okay.
I have no intention of probably saying very much. So
that's what I have. I'll keep everyone updated as things change. Yeah, so there we go.
Okay, Martha.
I'm going to be attending the NACO board meeting this week. And that's where we'll be doing the business of the National Association of Counties. It appears as if I have been appointed for life on the AOC board of directors. I didn't know that came with the presidency, but I guess it does. And I'm going to be working with them, I think, pretty consistently to try and coordinate between the state and the federal federal group, and I'm looking forward to that. I don't know if anyone else has registered, but it is Friday. And I think you are welcome to join. It's Friday and Saturday, basically. Yeah, they were actually going to try and do an in-person meeting, but because of the surges across the country, that's been canceled. And once again, it's all virtual. So that's what I've got.
All right, thank you, Martha. Ken?
I don't have a lot, Mr. Chairman. My wife and I continue to deliver food out to the senior centers in Sandy, Hoodland, and Estacada. The need continues and probably is expected to do so until we get through this COVID crisis. They are a little short on volunteers at the senior center in Gladstone, where they pack the food. So if anybody has some time on a Monday morning early just to help pack food, that would definitely be appreciated. You can contact Alex and he will see that you get scheduled in. So that's all I have.
All right, thank you. And I'll have enough to talk about this afternoon, so let's break for lunch, and 1:30 it is. Right, Gary?
Yes, 1:30. You have a full afternoon, commissioners, so I doubt we'll finish before 5 today. Just heads up.
All right, thank you, Gary. See you at 1:30.